California's new COVID guidance for healthcare workers is drawing major criticism from the workers themselves. Good evening, I'm Vanessa Van Hefty. The interim recommendations say healthcare personnel who test positive for COVID-19 and are asymptomatic may return to work immediately without isolation or testing. The guidance is in effect through February 1st. ABC 10 News reporter Nia Watson joining us live in Chula Vista with whether local hospitals are following the new guidance.
Vanessa, the State Department of Public Health updated its guidance because of the severe staffing shortages we're seeing in many hospitals, including here in San Diego County because of the Omicron variant. But the hospitals we reached out to don't seem to be on board.
Governor Newsom, rescind this dangerous policy. It's ridiculous. Rescind it.
When the California Department of Public Health sent out the new guidance for asymptomatic healthcare workers on January 8th, nurses across the state protested against it. That message remains clear in this Facebook video posted Sunday with California Nurses Association President Kathy Kennedy.
You're shedding the virus, whether you're asymptomatic or not. So why in the world would a nurse or a healthcare worker go immediately back to work?
CDPH says the return to work policy should be the last resort for facilities faced with staffing shortages. We reached out to local hospitals to see if they were adhering to the state's new guidance. Kaiser, UCSD Health, Sharp Healthcare, and Scripps all stated they were not allowing asymptomatic healthcare workers to return immediately. Kaiser says they're following the CDC's update, which shortens isolation for asymptomatic healthcare workers to 7 days and people in general to 5 days. UCSD Health says if asymptomatic healthcare workers may return to work on day 5 with a negative test or day 10 without a test. Scripps called the state's update a, quote, unsafe practice. Instead, they're bringing staff back after 5 to 7 days on a case-by-case basis. Sharp Healthcare says it currently has around 700 employees out due to COVID. Only around 45 of them are asymptomatic. Sharp says those workers can return as early as day 5 with a negative test taken that same day or day 11 without a test. The state's guidance also says asymptomatic staff who return to work immediately must wear N95 masks. They should also be assigned to COVID-19 positive patients when possible. Live in Chula Vista, Nia Watson, ABC 10 News.